I think that's where we'll get to this year, and I'm glad to have some of my colleagues on the floor of the House to talk about this tonight, in particular the Doctor of the House, Representative Steve Kagen.
Thank you, Congressman Murphy. It's good to be with you again on the House floor where we can begin to discuss with the American people about progress we can make together, and only by working together are we going to bring about the changes that we need. Now, we did come here in 2006, in November. We came for orientation, and we came with a message, and the message was about positive change. Now, I'll just give you the good news, just in case people haven't heard it across the country. There's been a change in Washington. We now have a president who can actually think things all the way through, someone who's really on our side for the changes that we need. And what have we done so far? Well, for the Marinick family that I have the honor of representing, this is a photo of Wendy and her 3-month-old child. And they didn't have access to a doctor at the doctor's office. She had access at the emergency room because she didn't have any health care at all. She was qualified for S-CHIP, but it wasn't fully funded. We passed S-CHIP in our first term here in the 110th Congress. We passed it, and the President signed it. And the very first thing that the President did for this country this year was to pass legislation that guaranteed that children who are most in need have access to the doctor in the doctor's office. It reduces taxes, reduces our costs, increases the health for our children, and prevents problems from getting worse. It's good for people's health, and it's good for our budget. So we began to take that positive change by helping children. We also passed a bill that may not seem to be too related to health care, Lilly Ledbetter. This was a bill that guaranteed equal pay for women. Now, of all of you here in the gallery, the few of you that might be here tonight, raise your hand if you're against equal pay for women. Raise your hand if you're against providing health care to children who are most in need at the doctor's office. I don't think we see a hand going up. Women and children first. That's what this 111th Congress has done with the help of President Obama and his leadership. Now, I have here a few postcards I've received from my constituents in northeast Wisconsin that pretty much tells it the way it is. David and Diane from Appleton, quote, "We have health insurance but cannot afford to use it," close quotes. Now, that's a problem. When you have health insurance coverage and the only thing it guarantees is that the insurance company is going to take the money, then you have to fight like heck to get the money back. They have high deductibles and can't afford to use the insurance they have. From Luxembourg, Wisconsin, Jim says, quote, "My wife and I have pre-existing condition with our health. Right now we pay $3,000 a year after 80% is already paid." Pre-existing conditions. You know, it's time that we applied our constitutional rights that prevent us from suffering from discrimination to the healthcare industry. No discrimination. No citizen, no legal resident in this country anywhere should be discriminated against because of the color of their skin. And likewise, they should not suffer from discrimination because of the chemistry of their skin. No discrimination based on the content of their heart. Well, what about the content of the arteries of their heart? We need to pass legislation that guarantees that no one will suffer from discrimination due to pre-existing conditions. Here's a card from Albert from Crivets, Wisconsin, who writes, quote, "Without a job that pays a fair wage, I won't have money to pay for health care, for gas, for a war, for Social Security, or anything else." It's really tough to separate health care from our economy and our economic recession, from the loss of the 6 million jobs during the last 12 months. We have to put this thing all together. One thing directly affects the other. Here's Kathleen from De Pere, Wisconsin, quote, "It's time for all Americans to have the same health care benefits as their representatives in Washington," close quotes. Well, that's not a bad start. I think people in our districts understand the situation just as well as we do here in Congress, and we're working very hard to bring about the changes that we need. And I yield to my colleague from Florida, Ron Klein.
Thank you.